Hello everyone, welcome to the channel MedVeda, where you seek a new learning experience with me. Here we observe the kind of rashes, angina, pale skin, and mainly the bone marrow biopsy. Differentiate the diagnosis made as aplastic anemia. Before that, remember the normocytic anemia of MCV, mean corpuscular volume of 8200. Then how the anemia occur? Based on reticulocyte count, if it is low, less than 2.5, that means low RBC formation. Then aplastic anemia is included. If reticulocyte count is high, greater than 2.5, means production of high number of RBC. In cases like blood loss and hemolytic anemia. Blood loss, such as acute, in most of cases of trauma, accidents, whereas hemolytic caused by two ways, intrinsic and extrinsic. Intrinsic means the defect within RBC itself, and RBC destruct by external factors like infection, immune mediated, non-extrinsic cause. I already explained detail in previous videos. Go and check. The links are provided in description. Now come to the topic aplastic anemia. It is a rare but serious condition by reduce all types of formed elements due to abnormality in bone marrow. Because of no RBC, no WBC and no thrombocyte except lymphocyte, it also named as pancytopenia with hypocellularity. Okay? Epidemiology. It most common in adults, adolescents and elderly. Women and men are equally like. Next, what are causes of aplastic anemia? Nearly 70% of aplastic anemia is idiopathic. Idiopathic means unknown. A number of acquired diseases, conditions and factors includes toxins like arsenic benzene. A brief of arsenic poisoning is basophilic stippling of basophilic dots in RBC, not of basophils stippling. Okay, hope you get. And exposure to benzene may have compromising of immunity system and contribute damage to DNA in hematopoietic cells. Okay. Next, radiation, chemotherapy such as treatment of cancer. Suppose a patient suffering with cancer, so given a chemo, then end up with a pancytopenia. Okay. Medications like chloramphenicol. It is an idiopathic mechanism, but proposed mechanism was chloramphenicol toxicity inhibit protein synthesis of mitochondria in RBC. It leads to hypocellularity. Okay. Infectious diseases such as hepatitis, Epstein-Barr virus, cytomegalovirus. Inherited conditions such as Fanconi anemia, a patient with a failure of bone marrow stem cells, known Fanconi anemia. Signs and symptoms. Signs and symptoms: shortness of breath, headache, coldness in your hands and feet, pale skin, gums and nail beds due to no oxygen carrying cells, chest pain and angina. Based on etiological, the signs and symptoms are: if a patient have Fanconi anemia, will have short stature and spots such as capillolate spots. Next, if a patient have telomerase defect, a brief tale of telomerase defect is shortening of telomeres due to TE or T gene mutation. Will have symptoms like graying of hair in young patient. Diagnosis: complete blood count. What will be the result if a patient has pancytopenia? RBC decreases, WBC decreases, platelets decreases, and MCV is normal. So decrease in reticulocytes, also known as reticulocytopenia. Now what the result of bone marrow biopsy? The aspiration of bone marrow is hypocellularity, where the hemopoietic cells is less than 25% of marrow space, replaced by fats and stroma, and intact of lymphocytes. Okay? What are the treatments of aplastic anemia? First, blood transfusions. These are administered to increase hemoglobin levels and improve oxygen carrying capacity in blood and help relieve of symptoms like fatigue and weakness in patient. Second, hematopoietic stem cell transplants. If donor available. If donor is not available, then we have to continuous progress of medications and avoid exposure to main cause such as toxins. Thanking you. For more videos, stay tuned to our channel MedVeda.